My husband and I have been together 30 years, been married 24. Up until having Shayla, our life was like normal. I wanted to have the 2.5 kids. We were going to have the white picket fence, all of those things that everybody thinks are just normal. We had our kids 2 years apart, just the way we planned. I'm a planner. It was important for me to have things the way we planned them. And then we had Shayla, and everything changed. Shayla's complications started immediately after birth. She was born and she wasn't breathing. 2 days later, she was transported to Marshfield, where we started to figure out what was going on with her then.
So Shayla has met probably all of our subspecialists, or many of them, because she is such a complex young lady that she has required a lot of specialty care. She definitely has difficulties with many organ systems, including the pancreas, the kidneys, the brain, the intestines. Lots of different organs in her body are not functioning the way they should.
Having everything in one place has been such a lifesaver. We're so lucky to be so close to a facility that has all the specialties Shayla needs. We can get everything we need right now at Marshfield Children's. She was actually in the hospital in peds, and she was a little agitated. And one of the child life specialists said, "We have this cart that has all these lights and things on them, and we'd like to bring it in and see if Shayla would like it."
Once we'd set the cart up in her room and we turn on the music and we turn on the lights, you could actually see the tension in her body relax. Watch her different parts of her body relax. She'd calm down. She'd stop crying, or maybe reaching out to bite her hand, or due to some of the pain she was having. And you could really see that she just calmed and relaxed with the environment that was presented for her. The Snoezelen room is a place where we are able to take patients away from the medical environment and bring them into an area that, after assessing their needs, we can figure out what sensory environment is going to be good for them. And the space allows them to kind of recenter themselves and reduce that stress and anxiety of being in the hospital. So when Angie and I were talking one day, I said, "Have you ever thought about doing a Make-A-Wish for Shayla and focusing on creating a bedroom for her with a multisensory feel?" And she was like, "Wow, yeah, that's a great idea."
There have been times where we can't keep things bandaged enough and keep the infection away. So this is kind of not really the fix for that, but very much of a help for that. It keeps her calm, and in that way, she doesn't scratch herself, no infections, and less hospitalizations. It's amazing the difference one room in the house can make, and it's always that room. I'm not gonna lie, it's a tough job. Taking care of her is a tough job, but I would not trade it for anything. I think it makes me a better person. And I could not imagine my life without her. Every single day, I get out of bed and I think, I know what the first hour and a half of my life is going to be like, because the first hour and a half of every single day is all about Shayla. It is about getting her fed, her meds, giving her a bath, getting her ready for her day. And after that, it is whatever happens, and we just adjust. I don't know how else to describe it. It's just been our life for the last 18 years, and that does not go with planning.